Okay, so hi guys. So our topic for the third module is about the Mastigophora. Okay? So question, what is the organ of locomotion for Mastigophora parasites? For protozoan parasites under Mastigophora. Okay? Ano guys? So that is flagella. So they can move with the use of the flagella. They can travel with the use of flagella. Okay? So, first parasite on our list, the Giardia lamblia. Okay? So, Giardia lamblia or Giardia duodenalis because that was its older name. Okay? So, or other name. So, Giardia lamblia is also an intestinal parasitic flagellate. Okay? So, that is known to cause epidemic and endemic diarrhea. So, other term for Giardia lamblia, Giardia intestinalis, duodenalis, Lamblia duodenalis or Lamblia intestinalis. So, it refers to the same parasite. So, major diseases, guys, caused by Giardia lamblia, dysentery, okay? So, dysentery, this parasite causes dysentery, malabsorption syndrome, okay? So, malabsorption syndrome, and Giardiasis or lambiasis, okay? Giardiasis or lambiasis. Giardiasis or lambiasis manifests a significant non-life-threatening gastrointestinal disease. So, Giardia lamblia inhabit the duodenum, which is a part of the small intestine, okay? The jejunum and the upper ileum of humans, okay? So, the Giardia lamblia, what I love about this parasite is its morphology, okay? So, you can easily recognize this one because of its very nice morphology. So, this is symmetrical, guys. So, it's like a symmetrical, bilaterally. So, take note of this one. The Giardia lamblia is bilaterally symmetrical. Okay? But aside from that, guys, you can see that it's an easily recognizable parasite, okay, because of the presence of its ventral sucking disc, okay, or this ventral disc, okay. That's why it is also referred as the parasite with glasses, okay. So that is the parasite with the glasses, okay. So sometimes you can hear this parasite as the old man with eyeglasses, okay. So the old man with eyeglasses. So the trophozoite, so it has two morphologies. It exists in two stages, guys. Okay? So just like the amoebas, it can exist as a trophozoite and it can exist as a cyst. Okay, so we define the morphology of the trophozoite. That is, it has 9 to 12 micrometer long, okay, by 5 to 15 micrometer wide. So, it is piriform, okay, so with pointed posterior end. So, take note of this one, it has a pointed posterior end, okay. So, the dorsal surface, this one, that is convex, and the ventral surface concave with, okay, baliktad. So, the dorsal surface, okay, and the ventral surface concave also. This is the convex, okay, diba? Pag ganon, that is convex. So, pag ganon, that is concave. So, this is the ventral surface concave. This is the dorsal surface convex. So, ventral surface concave with large adhesive disc for the attachment. So, this one, this ventral disc that is used for the attachment, okay? That's why sometimes that is referred as the ventral sucking disc, okay? So, that is bilaterally symmetrical, okay? What do you mean by that? Symmetrical. So, what you see on the other side is the same with the other side. So, it exhibits two nuclei, that is for the trophozoite. It has two nuclei. It has an axostyle as well, okay? So, the presence of axostyle, okay? And 4 pairs of flagella. Therefore, how many pairs of flagella does the Giardia trophozoites have? Okay, ilan ang kanyang flagella? So, there are 8. Okay, so let's check what are these 8 flagella. So, first on the list, we have here the anterior flagella. So, that is a pair. Okay, so 1 pair. So, 2 anterior flagella. Okay, as well as if there is an anterior flagella, if there are, kasi dalawa pala yun. If there are anterior flagella, there are also posterior flagella. Okay, a pair. So, 2, 2, that is already 4. Another that is there is the caudal flagella here. Okay, so the caudal flagella, 1 pair. So, that is already 6. And the other pair, that is the ventral flagella. Okay, anterior, posterior, caudal, ventral flagella, a total of 8 flagella or 4 pairs of flagella. So, motility. Okay, so paano ang kanyang paggalaw? So, it has an erratic tumbling motion. Okay, for some, they refer this also as the falling leaf motility. Okay, so the Giardia trophozoite has an erratic tumbling motility or motion or falling leaf motility. Okay, so take note also that it is a teardrop shape. Okay, so pagbaliktad ha. Okay, so that is a teardrop shape. Okay, so the Giardia trophozoite exhibits a teardrop shape. So, the trophozoite that is actively moving in the feeding stage. Okay, so that is a general characteristic of the protozoan parasite. The feeding stage is the moving stage. Therefore, the trophozoite is the feeding stage kasi nga it can move towards the food. Okay, nakakagalaw siya papunta sa pagkain. Kaya, yan yung feeding stage. Unlike for cyst, that is the non-feeding stage, inactive stage, kasi it is trying to preserve its content. Kumbaga, that is inactive. Okay? So, habitat, small intestine. Okay? Small intestine, but may invade also the common bile duct. It resembles an old man with eyeglasses. So, that is Giardia trophozoite. Okay? So, the Giardia cyst morphology, it has an oval or ellipsoidal in shape, unlike for the trophozoite that is teardrop shape. Okay, eto naman, medyo pahaba. It's not spherical. Kasi when we say it's spherical, it's circular. Okay, bilog na bilog. But this is oval or ellipsoidal in shape. Okay, so napapansin nyo para siyang duli. Okay, nuclei. So, for the nuclei, so we have to, if that is a young cyst, okay, so that is a young cyst or premature cyst, it contains only 2 nuclei. So, like this one, this is a young cyst, okay, young cyst, okay, so young cyst, 2 nuclei, mature cyst, 4 nuclei, okay, so mga cyst, nakukuha nyo pa ba ang ating lesson, okay. So, axis style runs diagonally through the cyst. Okay? So, the axis style runs diagonally through the cyst. The flagella shortened and are retracted within the cyst. Therefore, the cyst does not contain the flagella outside its structure. Okay? Outside its main structure. Okay? Kasi nga, nasa loob na yon. Flagella shortened and are retracted within the cyst. So, the cyst also may remain viable in the environment for many months. Okay? Pwede siyang mabuhay sa environment for many months. So, the cyst forms as trophozoites become dehydrated when they pass through the large intestine. Okay? So, if they can feel or they can sense that there is dehydration or low level of water, particularly in the large intestine, di ba, kung form yung stool mo, okay, kung form yung stool, so, they can, is it exist or insist? They will insist. Magiging cyst sila from trophozoite, okay? So, Mode of transmission, fecal-oral route transmission. Okay, so what are other modes of transmission for Giardia lamblia, guys? So guys, the Giardia lamblia has a tough outer shell. Okay, so this tough outer shell of the Giardia lamblia allows it to survive for 45 minutes even in chlorinated pools. Therefore, okay, aside from fecal-oral route or hand-to-mouth transmission by transmission of food and water contaminated with feces containing the Giardia lamblia, okay, so the Giardia lamblia can also cause recreational water illnesses, okay? Which means that this parasite can be spread through pool in the water, okay? So, pwede mo siyang mainom while if the swimming pool water is contaminated with this parasite, okay? So, we have here, so this is the life cycle of the Giardia lamblia. So this is from the Center for Disease Control and Prevention. So as you can see here, guys, when the I stands for infective stage. So this is the stage that infects other people. Okay. So while the cyst and the trophozoites, these are the diagnostic stage. What do you mean again by the diagnostic stage? These are the stages that can be seen in samples. Okay, so body samples or body fluids. So can you classify this one? Is it a premature cyst or an early cyst or a mature cyst? So this is a mature cyst. Cyst. Ito ay isang mature na cyst. Char, corny. Okay, because of the presence of 4 nuclei. Okay, so the cyst can survive for several months, and infection occurs by the ingestion of cyst in contaminated water or food or through fecal-oral mouth transmission, and possible din sa recreational water. So, that, guys, you cannot see that often in books, but infection through the recreational water has been documented by the CDC. Okay? So, in the small intestine, so if the cyst is present, okay, in the food that we eat, okay, or in recreational water or in the water, okay, that will, again, will it exist or will it exist in the small intestine? Ano mangyayari sa kanya? It will exist na, okay? X, magiging past cyst na siya kasi magiging trophozoite na siya, okay? When it reaches the small intestine, okay? It will exist. So, bakit hindi sa stomach, guys? Because it must protect itself from the acidic stomach. So, in the small intestine, existation releases the trophozoites. Okay? So, take note, guys, that each cyst produces through 2, okay? 2 trophozoite. Isang cyst, mag-produce siya ng 2 trophozoite. Okay? So, trophozoites multiply by longitudinal binary fission. Okay? So, para din kagaya ng method of division by bacteria. Okay? So, but it is more of longitudinal binary fission, and it remains in the lumen of the proximal small bowel where they can be free or attached to the mucosa by the ventral sucking disc. Okay? So, they can attach to the mucosa into the small intestine. Okay? With the use of this one, yung para nilang glasses, the ventral sucking disc. Okay? And then, incestation depends on the consistency of the stool. If that is watery, take note, guys, that this is a protozoan parasite. So, most likely, if the stool is dehydrated, just like for semi-formed and formed, it will encyst. Pero kapag hindi naman, it will remain as, what, guys? It will remain as trophozoite. So, in your previous quiz, I asked there, okay, so what are the parasites, okay, that can be seen in a formed stool and watery stool. Okay? So before when when I was just discussing protozoan parasite, mini-mention ko palagi na ang makikita sa stool, okay, are formed stool and semi-formed are diseased, okay? While for the trophozoite, it can be seen in a watery stool. But then again, guys, nasa discussion kasi tayo nun ng protozoan parasite, okay? Kaya yun yung mini-mention ko lang, okay? But then again, when I was discussing the laboratory methods, I already added the helminth eggs and larvae. Sinabi ko naman yun sa discussion natin. Okay? Inulit ko pa. So, even if you go back to our discussion in the laboratory part, I really mentioned that aside from protozoan cysts, okay? So, protozoan cysts that are seen in a semi-formed or formed stool, the helminth eggs and larvae, okay, can be seen in any form of stool. Okay, walang pakialam si helminth eggs and larvae kung ano yung type ng consistency ng stool. Okay? So, kahit balikan nyo pa yung recording, nandun yung sinabi ko. Okay? So, multiple binary fission. Okay? And then, depending on the consistency of stool. Okay? So, it follows the general rule. Kasi nga, this is a protozoan parasite. For protozoan parasite, okay, if this stool is dehydrated, okay, so magiging cyst sila. Magiging cyst sila. Okay, kapag dehydrated, just like sa semi-formed and formed stool. Okay, however, if that is watery, most likely, it will remain as a trophozoite. Okay, so that is for protozoan parasite. Okay, so because the cysts are infectious when passed in the stool or shortly afterward, person-to-person transmission is also possible, while animals are infected with Giardia. So, their importance as a reservoir, however, is unclear. So, animals can also be infected, okay? However, okay, the importance of these reservoir hosts are not clear. So, we're done with this one. So, infective form, mature cyst, routes of transmission, fecal-oral, person-to-person, daycare, nursing homes, mental asylums, and swimming in contaminated recreational water. Okay? So, I was not able to reiterate this one. Guys, take note if, okay? So, if an infective stage is passed through the stool, okay? So, kung nakikita din yung infective stage sa stool, person-to-person transmission is always possible. Okay? So, hindi mo lang siya pwedeng makuha. Pag fecal-oral kasi, di ba, you get the infective stage in the food or water. Okay? Contaminated with the parasite. Okay? But person-to-person, makukuha mo siya sa mismong tao. Okay? So, for example, in a daycare center, okay? So, the infective stage, the cyst stage that is present with another child can be passed to other children. Okay? So, for example, hinawakan ng bata yung kanyang puwet. Okay? May naiwang tae, merong cyst. Okay? So, may napuntang cyst sa kanyang kamay. And then, okay, may kina-holding hands siya. Yung kina-holding hands naman niya, na-infect na yung kanyang kamay. Okay? So, pag sinubo niya yon and his infected hands contain the infective stage, which are the cysts, then there's a possibility that the other children is also infected. So, that is another way. So, person to person. Okay? Even in nursing homes, okay? And mental asylums because of their poor hygiene. Pathophysiology. So, the Giardia decreased expression of brush border enzymes. So, if you remember, okay, in your histology, kung may naalala pa kayo, the small intestine is rich with microvilli. Why is it rich in microvilli? Because the microvilli increases the absorption function of the cell. Okay? And take note, the small intestine is the part wherein majority of the absorption of the nutrients that we derive from food happens. Okay? But for Giardia lamblia, anong ginagawa niya? Pinapaliit niya yung expression ng microvilli, the brush border enzymes. So, therefore, there will be a morphological change to the microvillus, and a possibility of a programmed cell death. Okay? So I forgot also. Okay? So, can this be transmitted um, through sex? Okay? Kagaya ng si George Entamoeba histolytica. Yes, guys. Okay? So, pwede rin siyang ma-transfer through sex. So, paano nangyayari yung transfer of protozoan parasite through sex? Okay? So, this is more commonly, okay? So, more commonly sa mga gay, okay? Sa mga gay individuals. Okay? So, we have a term, anilingus and fellatio. Okay? So, we define anilingus and fellatio. If that is anilingus, okay, so that is the oral and anal sex act in which a person stimulates the anus of another by using the mouth, including lips, tongue, or teeth. Okay? So, pag ino-oral sex, okay, yung anal area ng isang individual, okay, and that individual is infected with Giardia lambia, okay, and merong Giardia lambiasis na naiwan sa kanyang anal area, okay, tas nag-perform ang kanyang partner ng anilingus. So, if the anal area of the sexual partner contains the Giardiasis, possible na ma-infect yung isang individual. Okay? So, another is fellatio. That is an oral sex act involving the use of the mouth or throat, which is performed by a person on a penis of another person or oneself. Okay? So, anilingus or fellatio, any of this method, it can lead to infection of the Giardia lambia. Okay? So, guys, mag-isip-isip din, okay? So, I hope, okay? So, kung meron mang gumagawa, but sana naman, di ba? Still, that is your choice, but you have to do it properly. Okay? You have to do that properly. Of course, I do not encourage you, okay, to do that one. I really don't. But in case lang naman, if you have friends, you have to tell them or you have to enlighten them as well. Okay? So, possible talaga yun. So, take note, guys, of this one. The pathophysiology of the Giardia, it decreases the expression of brush border enzymes, nagkakaroon ng morphological changes sa microvilli, and nagkakaroon ng programmed cell death of the small intestinal epithelial cell, wherein it results to malabsorption syndrome. Okay? Magkakaroon ng malabsorption syndrome. Okay, so the attachment of trophozoites causes villi flattening and inhibition of enzymes that break down disaccharides in the sugar. Okay, kasi nga tinatarget nila yung mga microvilli. Okay, so anong mangyayari? Mai-inhibit din yung enzymes. Aside from that, the alteration of the villi leads to inability of nutrient and water absorption sa intestine. Okay? So, that can lead to malabsorption. Giardiasis can cause weight loss. Okay? So, magiging payat yung individual. And failure to absorb fat, lactose, vitamin A, vitamin B12. Okay? Because of the malabsorption. Nakukuha because of the malabsorption. So, pwedeng hindi nila ma-absorb ng maigi yung nutrients from the food that they are eating. Okay? Malabsorption of fat, even for lactose, even for the vitamins. So, hindi sila ma-absorb properly. So, if you remember in biochemistry, there are a lot of morphological changes in the body if there is vitamin deficiency. Diba? Sa vitamin A, okay? So, even sa vitamin B12. So, Giardia protects its own growth by reducing the formation of gas, nitric oxide by consuming all local arginine. Okay, so kakainin lahat ni Giardia ang arginine that are present in this small intestine. Okay, so that is to protect itself from the formation of nitric oxide. So arginine starvation is known to be a cause of programmed cell death. So, paano nangyayari yung programmed cell death sa Giardiasis infection? Because, yun nga, the Giardia, okay, it reduces the formation of the nitric oxide by consuming the arginine. So, it consumes the arginine, and if a cell does not contain or if it contains a very low arginine content, anong mangyayari? That will lead to programmed cell death. Arginine starvation is known to be a cause of programmed cell death. So, yun yung nangyayari sa Giardiasis. And Giardiasis can also cause dysentery. Okay? So, dysentery. So, you search on dysentery. Ano kung ibig sabihin ng dysentery? Para hindi naman lagi si ma'am. Okay, so, mostly are asymptomatic. Most person infected with Giardia are asymptomatic. And what does that mean, guys? Wala silang symptoms. So, acute watery diarrhea, possible din ng magkaroon ng abdominal cramps as well as bloating. So, stool is profuse and watery and early disease. There is also a voluminous, foul-smelling, and greasy. Okay, so greasy, foul-smelling, voluminous, foul-smelling, and greasy, that refers to steatorrhea. Okay, so magkakaroon ng voluminous, foul-smelling, and greasy stool later. Okay, kapag early pa lang, stool is profuse and watery, pero kapag tumatagal, nagiging steatorrheic na siya. Okay? So, chronic diarrhea, that is with malabsorption syndrome. Okay? So, anong ibig sabihin yan? Acute infection, it leads to acute watery diarrhea, abdominal cramps, and bloating. Pero kapag chronic infection na, that can lead to chronic diarrhea with the malabsorption syndrome. Okay, so laboratory diagnosis, direct fecal smear of stool. Okay, bakit direct fecal smear? Again, because the diagnostic stages are found in this stool sample. Okay, so duodenal aspirations as well. Duodenal aspiration, kukuha ng sample sa may duodenum. Okay, so there is also the enterotest, a gelatin capsule containing a nylon string with a weight swallowed by the patient. The free end of the string is fixed to the mouth. So the capsule dissolved and the string is released in the duodenum. So after 6 to 8 hours, the string is removed and any adherent fluid is placed on a slide for microscopic examination. So how is it done? So this one, guys, meron siyang capsule. Okay? So in the enterotest, a gelatin capsule with a nylon. So anong gagawin dyan? So, kakainin yan or i-ingest yan ng patient suspected to be infected with Giardia lamblia. Okay? So, and then, that is released into the duodenal area more. Okay? So, sa may duodenal area. Okay? So, what will happen? Ito kasi nasa stomach pa lang siya eh. Pero, sa may duodenal area, siya dapat mapunta. So, after 6 to 8 hours, the string is removed. Kukunin yan ulit. Okay? And any adherent fluid is placed on a slide for the microscopic examination. Okay? To check kung meron bang Giardia. Okay? So, microscopy, direct wet mount, trophozoites in saline wet mount. Okay? If you want to observe the motility, again, you have to do a direct wet mount. Okay? Bakit? Kasi hindi mo siya i-fix. Okay? And watery yung environment. So, you perform a saline wet mount. Pero kapag you want to, okay, trophozoid in saline wet mount, but if you want to observe for the morphology of the cyst, you do the iodine wet mount. Okay? Para mas maging clear yung kanyang morphology. Okay? So, stained stool smears, you can use trichrome and the iron hematoxylin. Prevention. Okay? Avoid food and water that might be contaminated. Okay? Pero mahirap kasi to, di ba? Kasi we Filipinos, we love to eat anywhere, sa may kanto, sa may tusok-tusok. Okay? So, filtration of water also. Okay? So, filtration of water para matanggal yung mga parasites, as well as bacteria. Boiling of water in activation. So, it's like you're killing the organism, because that you're killing the organism. So, addition of a tincture of iodine are effective in killing of cysts. So, you also practice good hygiene, wash hands thoroughly, and after using toilet and before handling or eating food. Okay, and aside from that, okay, so practicing safe sex. So, treatment. Nitroimidazole derivatives, just like the metronidazole and tinidazole, afidinide, litiquanacin, and nitrofurans, or the under nitrofurans, the furazolidone. But the drug of choice is the metronidazole. Okay, drug of choice, metronidazole. So we proceed with the other parasite, Dientamoeba fragilis. Okay, so morphology of the trophozoite. So that is this one. So you read motility. Pseudopods are angular, striated, or bored lobe, and hyaline is almost transparent. So the nucleus, okay, of the trophozoite, it contains two. Kaya nga siya di. Okay? Two. It refers to the two nuclei of the parasite. Peripheral chromatin, wala. Wala siyang peripheral chromatin. Carysomal chromatin, large cluster of 4 to 6 granules. It is finely vacuolar with vacuolated cytoplasm, and its inclusions are bacteria. Okay, so from its name, guys, di means two nuclei. Okay, so ENP means it is found in the enteric environment. Okay, so enteric environment where the organism is found. Okay, of course, the amoeba, because this is also an amoeba. So, and fragilis. The species name fragilis refers to the fact that this is a fragile parasite. Okay, fragile siya. So, they do not survive long in the stool after leaving the body of the human host. Okay, because this is fragile. It's die and dissociate when it is placed in saline, tap water, or distilled water. Okay, so madali po siyang mamatay. So, sana kung gano'n na lang sana lahat ng parasite, di ba? Okay, so, take note guys that it has no flagella, but with a leaf-like pseudopodia. Okay, it has a flagella with a whip-like pseudopodia. So, it has ingested bacteria, no peripheral chromatin. Okay, the absence of peripheral chromatin. Okay, so in 2014, cyst and pre-cyst stages were described for the first time in clinical human specimens. So these data are still considered preliminary, and further testing should be done to validate the existence of this stage in human host. Okay? Because guys, in Dientamoeba fragilis, what is only recognized as the stage are this one, how do we term this one? The trophozoite. Okay, so the trophozoite are the only recognized stages of the Dientamoeba fragilis. Okay, so parang wala pa siyang cyst stage. Wala pang cyst stage na nakikita. Okay, so kailangan pa nilang i-validate yung findings noong 2014. Ewan ko na lang ngayon. Di ko na na-check. Okay, wait lang. Okay, so for the life cycle of the Dientamoeba fragilis, just delete this one. Oops, sorry. Wait. Mali yung natanggal. Okay, so the Dientamoeba fragilis is probably transmitted by fecal-oral route transmission. Okay? So, and the transmission via helminth eggs like the Ascaris and Antrobius has been postulated once. Kumbaga, that is co-infection of eggs of Entamoeba vermicularis Okay, that is also searched throughout the body. So, para siyang vector. Okay, so, co-infection with Enterobius vermicularis and Ascaris lumbricoides, there is a possibility of co-infection with the Dientamoeba fragilis. Okay, so trophozoites of Dientamoeba fragilis have characteristically one or two nuclei. Okay, so one or two nuclei. And it is found in children complaining of intestinal diseases like intermittent diarrhea or abdominal pain, as well as other symptoms like nausea, anorexia, fatigue, malaise, and poor weight gain. Okay, so same thing that is ingested. Okay, so in binary fission and the trophozoites in the lumen of column. So it has been postulated that transmission occurs via helminth eggs such as Ascaris and Enterobius. Okay? But one thing is not clear to me, guys, kasi nga this is a trophozoite. And it was mentioned that this is a fragile parasite. However, it can infect individual with its trophozoite only. Diba? Okay. Habitat of the Dientamoeba fragilis. So, that is found in the mucosa of cecum and upper colon. Therefore, that is in large intestine. Mode of transmission, fecal-oral route or transmission of helminth eggs. Okay, fecal-oral route or the transmission of helminth eggs, because the helminth eggs may serve as vectors or carriers of the Dientamoeba fragilis trophozoite. Pathogenesis, signs and symptoms, severe abdominal pain and loss of appetite, intermittent diarrhea with mucous abdominal tenderness and bloating, so chronic infection that may lead to irritable bowel syndrome. So diagnosis, that is DFS, direct fecal smear, identification of trophozoite, so saline wet mount, okay? So treatment, iodoquinol, tetracycline, and the metronidazole. Okay, guys, so when Dientamoeba fragilis is placed in water, what will happen? The trophozoite swells and then returns to normal size. So in the swollen state, numerous cytoplasmic granules exhibit Brownian movement. That is, this feature is called the Haakanson phenomenon, and that is peculiar, okay, or an identifying characteristic of Dientamoeba fragilis, and occasionally is used in its identification. Okay, so we move to Chylomastix mesnelli. Okay. Okay, but according to pronouns speaking, that is chilo pala. Chylomastix mesnelli or mesnelli. Okay, so either of the two. Okay, mesnelli or mesnelli. Chylomastix. Okay, para siyang China. So, chi. It's not chai. Okay, so Chylomastix mesnelli. So, this is a non-pathogenic lumen-dwelling flagellate of humans. Okay? So, trophozoites morphology. So, that is a pear shape with stiff rotary motility. Okay? So, with stiff rotary motility. Hindi kagaya ni Giardia lamblia falling leaf motility. Okay? So, number of nuclei, it has only one nuclei. Isa lang ang inahin ng chicken. Okay? Sarap iulam. Number of flagella, there are 4. Okay? So, there are 3 in the anterior and 1 in the cytochrome. Okay? This should be cytostome, guys. Cytostome. Okay? Cytostome. Okay? 1 anterior and 1 in the cytostome. So, prominent cytostome extending 1/3 or 1/2. So, spiral groove along with the ventral surface. So, let's check this one. And let's bring that to front. Okay? Para mas clear. So, guys, take note of this one. So, our instructor before, he refers to this as the sash. So, parang ito daw yung sumasali. Ito yung parasite na sumasali sa beauty pageant because of the presence of sash, which represents, actually, that is the spiral groove of the Chylomastix mesnili. So, however, here guys, there are 6. Okay? Yun yung sabi. Okay? Magkaiba yung sinasabi ng dalawang libro. So, here it has 6 flagella, 3 free anteriorly, 1 in the mouth, and 2 surrounding the mouth. Okay? So, yun daw. So, meron daw siyang ano bang book to? I forgot. So, it also contains the blepharoplast. Okay? Blepharoplast. And it has a single nucleus with well-defined thin nuclear membrane and minute central or eccentric caryosome. So, sometimes, the caryosome can be found in the center or eccentric, hindi sa center. And the presence of the cytostome, okay? Parang kanyang oral cavity. Parang, okay? Cytostome and the presence of the spiral groove. Okay? So, the spiral groove that is present in the trophozoite stage. Okay? So, anterior projection. So, this one, it has a thick unstained cell wall that is for the cyst. So, the cytostome and remains of locomotor apparatus, and it has a single nucleus with well-developed membrane and central or lateral caryosome. Okay? So, that is for the trophozoite and the cyst stage. Okay? Diniscuss naman na kasi natin yung cyst stage. Okay? So, this one for the cyst stage. Take note, so Chylomastix mesnili cyst, okay, or the cyst of Chylomastix mesnili has the shepherd's crook, okay, and it has a clear knob on cyst. So, yun. So, the unstained part, okay, anterior projection. So, that is the clear knob, hindi siya nai-stain. And the nucleus, so, lemon shape with anterior hyaline knob or nipple. Okay. So, meron siyang nipple. Lemon shape with anterior hyaline knob or nipple. So, it has 1 nuclei. The cytostome with supporting fibrils. So, that is the shepherd's crook. And usually visible and in distinct preparations. So, for the life cycle of the parasites, cyst is the infective stage, okay? So, cyst, that is the infective stage. Diagnostic stage, both the trophozoite and the cyst. So, both cysts and trophozoites can be found in feces. So, infection occurs by the ingestion of cyst in contaminated food or water, possible fecal-oral route. So, pwede din to sa sexual transmission. Kasi nga, yung infective stage niya can also be found in the feces. Okay? Infection occurs by the ingestion of cyst in contaminated water, food, okay, through fecal-oral route or possible person-to-person contact. In the large intestine, okay, excistation releases the trophozoites. So, Chylomastix mesnili resides in the cecum and or the colon. So, that is in the large intestine. It is generally considered a commensal parasite whose contribution to pathogenesis is uncertain. Okay, so animals may serve as reservoir for Chylomastix mesnili. And why are we, okay, discussing this one if that is a commensal parasite? Because, guys, because they may result to false identification. Baka i-report mo siya kasi hindi mo alam na merong ganitong parasite. I-report mo siya kung ano-ano. Okay? So, it's better to know it. Okay? So, Chylomastix mesnili, again, they are considered as non-pathogenic. And the presence of cyst and trophozoite in the stool specimen can be an indicator of fecal transmission of food or water source. And thus, it does not rule out other parasitic infection. Which means that if you see Chylomastix mesnili, okay, either trophozoite or in the cyst stage in the stool, that already indicates a fecal-oral transmission. Okay? So, possible din na meron din siyang other parasite. Okay? Pero ang cute niya, no? It's really cute. Okay, we move to the Trichomonas. Okay, so there are three: the intestinal Trichomonas, that is the Trichomonas hominis, the Trichomonas vaginalis, and the Trichomonas tenax. So the hominis, that is found in the intestine, the vaginalis in the genital organs, and the tenax in the oral cavity or in the mouth area. So general morphology of the Trichomonas trophozoites. So they are pear-shaped, okay, which contains 4 flagella that extends anteriorly. So we have it here, 4 anterior flagella. Okay, so that is pear-shaped. So one flagellum extends posteriorly along the cell membrane, which forms an undulating membrane. Okay, so eto, meron siyang undulating membrane, di ba? May kung ano-ano siyang kaartihan. Okay, so posterior flagellum as membrane of the undulating membrane. Okay, so the costa, a rigid cord attaches the undulating membrane to the cell membrane and gives the undulating membrane a support. Okay, so the axostyle, it rounds down the middle of the body and ends in a pointed tail-like extremity. Hindi mapakali ang chicken. Diba yan? Round nucleus in the anterior portion. So, medyo nag-round dito sa anterior portion and the presence of this one. Okay, so that is the axostyle that runs until the, okay, the, what do you call this one again? The last part. Okay, so, until the extremity. Okay, so, round nucleus in the posterior portion. So, meron siyang round nucleus or spherical. Okay, so round nucleus or spherical nucleus. So, the caudal tip, that is emergent portion of the axostyle. Okay, so that one, that is the undulating membrane. Okay, so the Trichomonas hominis, other term, that is the Pentratrichomonas hominis. So, trophozoites morphology, so they are pear-shaped, motility, rapid, jerky, tumbling motility. Rapid, jerking motility. Okay, so that is for the Trichomonas hominis. Number of nuclei, 1 only. Number of the flagella, 3 to 5 in the anterior and 1 in the posterior. Okay, so 3 to 5. So, hindi din pare-pareho. Okay? Kasi meron siyang range. 3 to 5 in the anterior and 1 in the posterior. So, for the Trichomonas hominis, so again, that is found in the intestine. Okay, habitat, large intestine, especially in the cecum. So, mode of transmission, fecal-oral route, laboratory diagnosis, direct fecal smear, wet preparation of stool in NSS to see the active motile forms. Okay, so iodine preparation, that is to differentiate the morphology and possible na stool culture. Okay, so Trichomonas tenax, the other name, that is the Trichomonas buccalis. Okay, bakit buccalis? Kasi sa buccal cavity sila nakikita. That is non-pathogenic parasite that inhabits the mouth, especially in various teeth and organs. Okay, so morphology. Smallest among them, the Trichomonas tenax, that is the smallest. Okay, oval to pear shape. So the nuclei, that is not visible in the unstained mount. So flagella, 5 flagella, so 4 in the anterior and 1 in the posterior. Okay, motility, jerky motility, just like also for the Trichomonas hominis. So the undulating membrane extending 2/3 of the body length. Okay, so hanggang 2/3 lang yung body length nung kanyang undulating membrane. Okay? What else? So, habitat mouth, mode of, since that is found in the mouth, that can be transmitted through oral kissing. Okay? Oral, just like in kissing and sharing of utensils. So, pag nagsusubuan kayo ng jowa mo, kung meron siyang Trichomonas tenax, di ba? You're sharing. Okay? You're sharing each other's organism. So, also guys, according to studies, okay, so, kung madalas kayo mag-kiss ng partner mo, you will also share the types of normal flora found in the oral cavity of each partner. So, kumbaga magpapasahan din kayo. Okay? Mag-sharean kayo ng bacteria. So, laboratory diagnosis, syempre, hindi po tae. Okay? Hindi po stool sample. Mouth scrapings, microscopic examination of tonsillar crypts, and pyorrheal pockets, and tartar between the teeth and gingival margin. Okay, so the Trichomonas vaginalis. Okay, this is the largest. So, pinakamalaki si vaginalis, followed by hominis, and lastly by the tenax. Okay, so pinakamalaki yung nasa genital area. Susunod yung nasa intestinal area, and pinakamaliit yung nasa bibig. Okay, parang baliktad naman. Kung sino pa yung nasa genital area, siya pa yung pinakamalaki. So, pear shape, kagaya din ng iba, they are pear shape. Undulating membrane extends only half of the length of the body. So, we try to differentiate their undulating membrane. So, kay vaginalis, hanggang kalahati lang ng kanyang body length. Okay? So, kay tenax, hanggang 2/3. Okay? Pero nakalimutan kong i-mention to kay what do you call this one? Kay Trichomonas hominis. Kay Trichomonas hominis, hanggang end naman ng kanyang body length. So, siya yung may pinakamahabang undulating membrane, si hominis. Followed by this one, the tenax, kasi hanggang 2/3 of the body length. And pinakamaliit yung undulating membrane ni Trichomonas vaginalis, even if siya yung pinakamalaki sa kanila. Okay? So, kahit siya yung pinakamalaki, pero siya naman yung may pinakamaliit na undulating membrane. Okay? So, motility, jerky tumbling motility, just like the others. It has 4 anterior flagella and 1 posterior flagella. Okay? So, the axostyle. So, has axostyle, costa, and cleft mouth. Okay, so, how can you remember? How can you easily remember yung undulating membrane? Na pinakamahaba si hominis, susunod si tenax, and pinakamaliit yung undulating membrane ni vaginalis. So, meron na naman ako nagawang mnemonics para dyan. Okay? So, hanggang tumaeva. Okay? Ibig sabihin, si hominis yung may pinakamahabang undulating membrane. Pangalawa, si tenax, 2/3 of the body. And 1/2 lang yung undulating membrane ni vaginalis relative to the size of its body. Okay? Or body size. So, welcome guys. Okay? So, kung ano lang maitulong ko. Char. Okay, so we go to the life cycle. So, if you have noticed, guys, the three trichomonas that we discussed, they do not have cyst stage. Okay? Wala silang cyst. Trough lang ang meron sa kanila na stage. So, for the life cycle, so this is for the life cycle of Trichomonas vaginalis. Okay? Because this is the most important among the three. Okay, so trophozoites in the vaginal and prostatic secretion and urine. So that multiplies by longitudinal binary fission. And the trophozoites in the vagina or orifice of the urethra. Therefore, it can be passed through sexual contact. Okay? So, ma'am, how about if na-oral yung infected individual? Okay? Pwede ba yung mai-transfer kapag na-infect yung kanyang mouth ng trophozoite and ikinis niya sa ibang partner niya? Kunwari, di ba? Cheater siya. Definitely not, guys. Because the Trichomonas vaginalis can only be transferred through sexual contact. Okay? Hindi naman pwede na mai-ingest ng isang tao yung Trichomonas vaginalis and magkakaroon na siya ng vaginalis sa kanyang, ng Trichomonas vaginalis sa kanyang genital area. So, that must be a sexual contact. Okay? So using the vagina, or so that is penetration of the penis to the vagina. Hindi pwede yung sa oral sex. Okay, Trichomonas vaginalis, that is a common cause of vaginitis or inflammation in the vagina. Okay, so inflammation, itching, and the release of vaginal discharge. Etiologic agent of trichomoniasis, that is the Trichomonas vaginalis, is a common sexually transmitted diseases with worldwide distribution that is transmittable sexually and through contacts with seat, toilets, and bowel. So, aside from sexual contact pala, guys, so hindi kasi ako nag-review. Okay? So, aside from sexual contact, possible din na matransmit yan sa toilet seats and towel. That's why do not share. Okay? That's why do not share your towels. Okay? And do not just sit on a toilet if that is a public toilet. Okay? So, kasi pwedeng ma-transfer yan kayo ng Trichomonas vaginalis. Hindi ka man nakipag-sex, pero na-infect ka naman ng Trichomonas vaginalis. Take note, guys, the most common method of Trichomonas transmission is through sexual activity. So, paano yan pag na-diagnose ka ng doktor na meron kang Trichomonas vaginalis infection? Okay? So, pag sinumbong yan sa parents mo, diba? Most likely, nakuha ng anak niyo po through sexual activity of an individual or a sex partner that is infected with the Trichomonas vaginalis. O di, lagot ka na ngayon. Diba? Lagot ka na sa magulang mo. Uy! Okay? So, this one, guys, that is the inside part of this is a metal that can be used to enlarge the vaginal canal to get samples. Okay? Kagaya pag pap smear. Okay? So, vaginitis. In vaginitis or trichomoniasis, there is a profuse frothy discharge with yellow-greenish in color. Okay? With a foul odor and possible na magkaroon ng vulvar pruritus. Okay? Hindi yan pruritus. Patchy vaginal erythema, and the presence of this one. This is the strawberry cervix. Okay? So, yung may mga dots. So, that is the strawberry, that one. Okay? Strawberry cervix. So, that indicates vaginitis caused by Trichomonas vaginalis infection. So, guys, again, be extra careful in using the public toilet. Okay? So, going back, guys, kasi nakalimutan ko. Okay? One of the hallmark features ng Trichomonas vaginalis is the adherence factors that allow cervicovaginal epithelial colonization in women. So, the adherence is specific to vaginal epithelial cells. Okay? So, that is also the adherence factors. These are pH, time, and temperature dependent. So, the virulence factor of Trichomonas vaginalis are microtubules, microfilaments, and adhesins. Okay? Meron siyang 4 na adhesins. So, the Trichomonas vaginalis, so it produces 4 trichomodad enzyme. Okay? So, ano na nga ba yun? Yung mga enzyme. So, meron siyang 4 trichomonad enzymes. Wait lang. So, that is AP65. Maalala ko pa ng konti. That is AP65, that is AP51, AP33, and AP23. Okay? So, those are the adhesins na pinoproduce ni Trichomonas vaginalis. So, ano ba yung action nung mga yon? So, those mediate the interaction of the receptor molecules on the vaginal epithelial cells. Okay? So, aside from those adhesins, the AP65, 51, 33, and 23, they also produces cysteine proteinases. So, the cysteine proteinases, they degrade extracellular matrix like hemoglobin, fibronectin, as well as the collagen factor 4. So, those virulence factor contributes to the existence or to these characteristic changes in the vaginal area. Okay? So, if that's infected with Trichomonas vaginalis. So, parasitic diagnosis methods of examination, microscopy with vaginal discharge, urine sediment, and prostatic secretion for men. Okay? Possible din naman ang culture. Okay? Antigen detection using ELISA, whiff test. Okay? So, yan yung aamoy-amoyin. But this is not routinely done anymore. Pap smear, yung pag-open ng vaginal canal. Okay? With the use of this equipment. And getting samples, PCR method, polymerase chain reaction, as well as wet mount. Okay, so this is the whiff test. So, upon application of 10 potassium hydroxide to a vaginal swab, a fishy odor is released, which can suggest trichomoniasis or bacterial vaginitis. So, kukuha ka ng vaginal swab and then lalagyan mo ng 10%, 5 to 10% potassium hydroxide, wooden stick for mixing under the nose. So, guys, why is it not recommended? Because yung pag-amoy, okay? Because of smelling, okay? And smelling is sometimes subjective, di ba? And that is not also safe to the laboratory technologists. That's why that is no longer done. I don't know, pero hindi na siya recommended. Prevention. That is detection and treatment of cases for the both partners. Kaya guys, okay, stick with just one sex partner who's been tested and doesn't have any STD. But of course, in our country, we don't do this one. Okay? However, for some, kagaya na lang, there were cases when I was still working, there were cases wherein foreigners, they have their Filipina partners tested for STDs. Okay, siguro aasawahin lang nila kapag negative sila for sexually transmitted diseases. Diba? So bad. Okay? Pero siguro for safety concern. But how about them? Diba? Maganda sana kung both parties will be tested. To be fair on each other, mamaya, papatas yung foreigner, tapos siya pala yung merong infection. Okay? Avoidance of sexual contact with infected partners. And also, guys, sometimes, why is it that some individual gets infected with HIV even if they are loyal. Okay? The problem there is their cheating partners. So, kapag nag-cheat yung partner nila, nakipag-sex sila sa mga infected individual, tapos makikipag-sex sila ulit sa mga asawa nila. Okay? So, hindi lang sila yung na-infect, pero yung mga asawa na nila, kahit wala namang kinakasex ng iba yung kanilang mga asawa. So, yun yung mahirap doon. So, prevention is the use of condom. Okay? Especially yung mga mahilig sana sa yung mga binabayaran. Diba? Okay? Yung mga binabayaran. So, alam niyo naman yung ibig kong sabihin. So, dapat in that case, they must practice safe sex. Okay? Para hindi sila ma-infect. Para hindi rin ma-infect yung mga partner nila. Trichomoniasis vaginalis treatment should be implemented under medical supervision and should include all sexual partners. Okay? So, all, merong word na all. Ibig sabihin, kung marami siyang sexual partner, all of them must be, okay? So, must be treated. Okay? So, metronidazole and tinidazole are the drug of choices for Trichomoniasis vaginalis infection. So, for this part, I will end my discussion muna. And for the second part, I will discuss the different trypanosomas. Okay? So, medyo mahaba-haba din yan. Okay? So, thank you so much for listening. I hope you are learning well in parasitology and clinical chemistry because I'm really doing my best to edit my presentation, okay, so that it is easier to understand. Okay? So, I also check for many literature. Kahit na napapagod ako, you can see that I still define some terms na baka hindi nyo alam. Kasi kung minsan I was thinking na if I let you do that, baka wala na rin kayong time. So, kawawa naman kayo. Okay? So, God bless everyone. And lagi kayong magdasal. Okay? So, pray always. Matatapos din tayo dito. Okay? So, actually, there are students who are calling for academic freeze. Okay? But guys, before thinking about academic freeze, you have to think of your dreams. Okay? maswerte tayo kung 1 taon lang to or 2 taon lang to. Pero paano kung it will take us 5 years? Okay? Or 4 years, 3 years? Sa tingin nyo, magiging masaya kayo sa academic fees kung afford nyo namang mag-aral? Diba? 3 years kang natenga, imbis na graduate ka na, imbis na 3rd year ka na. Okay? So, paano naman yun? Diba? Gusto nyo bang matenga ng 3 taon, 2 taon, 3 taon na wala kayong ginagawa, nasa bahay lang kayo? Okay? Magsa-cellphone lang yung gagawin nyo. Sayang yung time. Okay? Time is precious, time is gold. Nag-K-12 na nga kayo, tas academic freeze pa because of the pandemic. So guys, though it's a lot harder, but you have to cope up, okay, for your dreams. Okay? Kasi tumatanda na din kayo. Okay? Pinatanda na nga kayo because of the K-12. Diba? So, God bless everyone. So, I hope you mind what you think, what you eat, and what you feed your mind. Okay? So, choose your battles wisely. Kasi the pandemic, it's already there. Nandiyan na siya, wala na tayong magagawa. What we can do is to cope up with the situation. Okay? Kasi kung susukuan mo, wala, talo ka. Take note guys, the world is always unfair. Okay? Laging unfair ang mundo. Kaya dapat matuto kayo maging malakas. Char! Okay, so that ends up my presentation. Thank you so much.